National Assembly Health Committee has called for heightened investigations into the recent cases of fraud involving some hospitals linked to the National Hospital Insurance Fund, that is NHIF. The committee is advocating for a thorough investigation to exonerate those found innocent, allowing them to resume normal operations. And as Elizabeth Atieno reports, members of the National Assembly Health Committee now say that it is necessary for the government to establish an independent body responsible for licensing and regulating private practice in hospitals nationwide.
On Monday this week, Health Cabinet Secretary Susan Nakhumicha said the GOtv scheme will be scrapped and learners will now be covered alongside their household in the primary healthcare fund. This is after 4.3 billion Kenya shillings was lost in the GOtv scheme that covers treatment for secondary school learners, forcing the government to stop the renewal of the scheme due to the alleged graft. As the probe into the alleged scandal intensifies, the Parliamentary Health Committee on Thursday toured the Bongo Chest and Skin Clinic in Ishiara, Embu County, where they established that the hospital had a slight mismatch in the records of students treated in the clinic under the GOtv program.
What happens, the Ministry of Education, the schools belong to Ministry of Education, but the teachers belong to TSC. That was to avoid a conflict of interest.
They further found that the records of 2 out of the about 2,000 students treated in the hospital were captured in the electronic records, but not in the hard copy records.
And he has explained himself that the problem was a system, and he admitted that the system missed the 2 students, but they are in the hard copy of his register.
The committee report has also questioned the high number of students that opted for the facilities currently under investigations, with speculations rife that the students were procured for the purposes of committing fraud.
His main accusation was that he got money from GOtv. GOtv is the insurance that was covering students unfairly. They said he influenced students to come to this hospital. He received so many students that list high blues.
The hospital's CEO, Dr. Dan Bongo, told the committee that the period when they had a high turnout of students was correspondent to a time when area schools were using contaminated and treated water, leading to an outbreak of a stomach ailment.
Because for them, they came, they accused, and they went and made a judgment away from there. We were not even told to appear. Personally, I was not even told to appear anywhere, to explain myself.
The vice chair of the committee, Patrick Munene, said the allegations of fraud had left the hospitals in limbo to the detriment of the patients.
Patients are suffering because institutions that were stopped from admitting patients who use NHIF, those patients are suffering because we know most of our people rely on NHIF.
The legislators have further proposed for the establishment of an independent body other than the Kenya Medical Practitioners and Dentists Council, KMPDC, that will regulate hospitals and clinics. The committee visited some hospitals in the eastern region mentioned in the fraud report. The legislators now say some of the hospitals have minor omissions and there is no valid reason as to why they should remain suspended. Elizabeth Atieno, TV 14.